For the cat-cow exercise, I'm going to show you two variations, one targeting the low back, the lumbar spine, and then one that targets and biases more of the mid-back or the thoracic spine. So when you're doing these exercises, you want to try to do at least a minute each, or you can follow along with all of the exercises in this group of the mobility flow with the link that goes through all of them at the same time. But if you want a little bit more, I'm going to go into just more of the how and why here in this video. So to target the lumbar spine for cat-cow, again, we're just working on spinal mobility here. So you're on hands and knees, keep a slight bend in the elbows. You're going to arch and let your belly move towards the floor. Head lifts up just a little bit. If you're having neck pain, you can always just keep your neck long here instead of going up like that. And then you're gonna round through this low back, just like that. As far as you can go, tolerate, and just maintain your normal breathing pattern. Inhale, exhale, come back down, arch, and inhale, round. Whatever feels best for you. As long as you're breathing through this, there's no particular way that you need to be breathing here. Just inhale and exhale as you move through this motion. If your back hurts when you arch, don't arch as much. Maybe stay more of a neutral position. Sometimes in those early weeks, just with excess weight as your uterus is shrinking back down, too much arching can sometimes be a little painful. So don't push into pain here, just do what feels good. So again, here we're focusing on that low back, just getting some movement in the spine. And then we're going to talk about biasing the thoracic spine. So the thoracic cat-cow, you're going to sit back and do your heels a little bit more to block out the lumbar spine. So we're focusing more on the mid-back. And place your hands just in front of you. And here again, you're extending. So here you should feel it more in the mid-back. And then exhale, round forward. Feel a good stretch here. Inhale, extend. Exhale, round. And again, if you're doing these on your own, spend about a minute or so for each one. And then I just want to show you a quick variation for this. If you're having a hard time feeling it through that mid-back, grab a band. And here, just having the band kind of helps give you some feedback to feel where your breath is going. So inhale. Exhale. So again, just rounding and extending through that mid-back. The band can help you feel that a little bit more. So if you're really stiff and are having a hard time feeling it, sometimes just adding a band can give you a little bit more feedback. But again, these exercises are both good for spinal mobility. We just want to get that spine moving. You have so many compensations that occur during pregnancy, so we just want to make sure we're doing